Hello guys, Dr. Qureshi here with you. Today's topic is going to be the differences between migraine and ocular migraine, because I get patients who talk about migraines, like the regular migraines where you get the headaches and you get the triggers, the migraine that comes with and without aura, you get the headaches and you get treated with your primary care doctor. But then I also get patients who just do not have the typical migraine, but they also have a condition which is known as ocular migraine. And in that migraine, they are, according to textbook, they should have a brief loss in vision for about 90 seconds. Not everyone has everything according to textbook, so sometimes it could be even less or even more than that. For instance, they could have loss in vision for about 5 to 10 minutes or even 15 minutes. So the patient that I had today was telling me her vision loss happened for about 10 minutes, and another one told me the other day was like 5 minutes. So it varies from person to person, but it will be a brief loss. So it's temporary, obviously it's not permanent. And then they will also complain about visual phenomena. For instance, they will say things like, oh doc, I'm seeing kaleidoscope kind of an effect. Or they will talk about seeing flashes of lights or colored lights, or they will also sometimes say they're seeing water, like waves and water, blue lights and stuff like that. So remember, that's an ocular migraine, and it doesn't necessarily have to come with a headache that happens with a typical migraine. Sometimes they may have a headache, sometimes they may not have a headache. So I always tell them to go back to their primary care doctor and get treated for migraines. Sometimes the treatment is not just over-the-counter migraine medicine treatment, but it requires prescription medicine. So it could be a beta blocker, it could be sumatriptan. So just let your primary care doctor know about it, and I mentioned that in the exam notes as well. I can treat them for the ocular migraine and the regular migraine, but a lot of times I involve the primary care doctors in the treatment plan also. Now, some of the things that I do as a doctor is definitely check their vision to see if their vision is affected on their particular day when they come to me for their eye exam. And then I also check their macula just to make sure they do not have any condition going on in the macula. So obviously you can dilate them or at least do fundus photos to monitor them for the future as well. And sometimes a visual field can be done also, so that we can determine if there's anything abnormal that can be detected with the visual field, because sometimes it could be a neurological condition as well. And I also always keep in the back of my mind if it's a neuro-ophthalmology condition, because if it's not a migraine, it's not an ocular migraine, then it has to be a neuro-ophthalmological condition. For that, I can always refer them out. So the visual field is one of the good tests to do, and even if you don't want to do it the same day, you can always call them for a follow-up, and then you can determine if the migraine or the ocular migraines is getting better or worse. For the regular migraines, obviously you can get treatment in the form of prescription, and you can also get injections like Botox injections as well. So read about migraines and ocular migraines, and if you ever have ocular migraines, the doctor that you need to consult with or go to is the eye doctor, the eye specialist, okay? And you can always tell your primary care doctors about it as well, but if you really need to get to the bottom of it, you should see the eye doctor or the eye specialist. And that's what I have been doing with my patients, giving them educational stuff, for them to read more about, to get more information about it so that they're well aware of the condition. Because sometimes patients would not know what an ocular migraine is, and they do not understand the term as such, as in like, okay, so it's a migraine in my eyes, or is it a regular migraine? What is going on? That visual phenomena can be very disturbing at times, because suddenly you just start seeing these colors or kaleidoscope kind of an effect, or flashes of light sometimes, which are not typically seen when you have retinal detachment. Those flashes of lights, as I've always told you in my previous videos also, are going to be in the peripheral part of your vision. The ocular migraine flashes could be, or lights could be, like seen in the center, like in front of your eyes as well. So those are some of the things to remember, and I'm glad that you guys are watching the videos and commenting also. Keep doing that. Maybe even suggest some videos that you want me to make. These videos that I make are normally based on what I see in the clinics, in the exam rooms, and also based on what the patients suggest to me sometimes. And not just patients, but even the audience from all around the world. Thank you guys. You have a good day. Bye.